Today we're going to talk about frozen shoulder. So what is frozen shoulder? It's when you have inflammation inside the shoulder girdle and it causes that capsule to become tight and lack range of motion. So a lot of times patients will come in and out of the blue, they just cannot get their elbow and arm past 90 at all. A lot of times it's like as little as this movement. So things you can do to help release this joint is obviously getting like some soft tissue work done in there, having some mobilization done by your practitioner. You can do the wall exercise where you're crawling up, trying to force that range of motion. Depending on which stage you're at in your rehab process, you can do this type of exercise, like inch it out, and then try to press down and force more movement there, depending. Obviously, if you can only get to this degree of motion, you're not going to be forcing that. You also want to make sure that you've ruled out it's actually not a rotator cuff muscle that's spasmed on you and is causing you to not be able to lift it. So your rotator cuff muscles are, I like to think of them as the easier way to think of them is sits muscles. So you have your supraspinatus, which does 15 degrees of flexion this way and 15 degrees of flexion up here. Then you have your infraspinatus, which does this motion. So a lot of times this one is affected most with my shoulder pain patients. Then you have your teres minor, which does external rotation down here. And then in the front, so all those muscles attach to the humerus and help that external rotation. Then the front, you have something called a subscap, which lines your scapula and helps with internal rotation. Another thing to think about is you could be having really bad latissimus dorsi tightness because that also attaches to your humerus and does internal rotation. So what that muscle does, it's like your hand cuff muscle. You go behind your back and internal rotation. So a lot of times you'll see that this is tight on someone if they're standing and they have to stand like this. A correct or relaxed posture would be with thumbs a little bit forward. But a lot of times when people have that lat tightness, their hands will be rotated towards the back because that shoulder's internal rotating. Another tip, something to rule out. So sometimes people don't realize how often we are in this flex forward posture and how much pressure you could be putting on this joint. It's called your SC joint, sternoclavicular joint. And there is a muscle that lies right underneath your collarbone called a subclavius muscle. It's really tiny, but if it's spasmed from things that you do, like, driving a lot, you're at the computer a lot, like I love to do spin classes and we do lots of push-ups on the bike. Let's say you are doing a lot of push-ups, or even you mountain bike and you're having to brace here, or you got into a car accident, whatever. But you probably wouldn't think that if the frozen shoulder just came up out of the blue. But sometimes people aren't aware of, that lack of range of motion could actually be coming from here. So you can try to strip the muscle right underneath. So you really want to follow it and get in there, and you want to go from medial to lateral, and you can grab lotion and do that, and then retest the shoulder. A lot of times with just lack of shoulder range of motion, that helps a ton. But this is a frozen shoulder video. Some people think that having just pain in the shoulder is frozen shoulder, but frozen shoulder really is when you have that inflammation of the joint capsule. So, other things that you can do if you have a practitioner that has like a hot laser machine, you can do that, put laser on there. Different, like I like to use Deep Blue by doTERRA. You can rub that in there and help with the inflammation, maybe like a CBD cream. That could be helpful. But I want to address what else it could be, because if you think of it this way, maybe you woke up with this frozen shoulder and it came up out of the blue. Usually when things come up what you call like insidiously, there was no action, there was no injury to the shoulder itself, it kind of just came out of nowhere. You want to think that it could be chemical or nutrition based. So there's actually research papers on this, and what I see really often, majority of the time when I have a patient coming in with a frozen shoulder that came out of nowhere, it's typically tied to a thyroid imbalance. So I just want to say it again. So if you're someone who's been trying to rehab your frozen shoulder, but you've never considered that a chemical stress can cause the frozen shoulder, consider this now. Maybe you'll get your thyroid levels checked. So it can happen for people with hypothyroid, where you're not producing enough thyroid hormone from your metabolism, or hyper, where you'd be over-secreting. And typically, hyperthyroid is connected, not always, but a lot of times it's connected to something viral going on. And so then it's causing inflammation at this thyroid, causing it to be overactive, okay? So just consider that. Another cause is, other metabolic conditions like diabetes. And I want to highlight that hypo can cause it, but hyper happens more often, can be a risk factor for you getting frozen shoulder. So hopefully this is helpful. I will put some different thyroid helping herbs in the description. And if you have any questions, please comment below, and I really hope this helps.